We live in the world of what to yesterday, but with your teeth it's best to go through things really slowly so you get exactly where you want to be.
Yeah.
And you'll come in for 4 or 5 visits with myself over the period, so yeah, that's where we need to be, and then it'll take you from there. So what generally happens then is the product we give you is probably about 6 to 8 weeks with whitening gels in the packs, but we also give you some top-up syringes, so you'll get about 10 syringes. And you'll keep those, and then the best thing to do is keep them out of the children's reach and just keep them into the bathroom cabinet. They're stable to be kept in the bathroom, it's not a problem whatsoever. And they make such a difference, because then when you're going out on a Saturday night, you can pop just before you go out, once you're getting made up, pop the trays in the little top up, it gives you a little bit of confidence just for half an hour to pull it back again. Now, different types of whitening gels. There's one we can do overnight, which is conveniently called Pola Night, and there's one which we can do during the day, which is Pola Day. The Pola Day is a little bit stronger, and it does it a lot quicker, and it fits into your lifestyle, and that's the critical thing with whitening.
Yeah.
It's funny when I whiten my friend's teeth that we found, the research says the more you charge for whitening, the whiter the teeth go, because people actually do it. My friends have got the whitening gels, I've done all the work for them, and they put it in the bathroom cabinet because they got it for free. You know, so you know, but that's life, isn't it? Some people value things. So what we generally work with our patients to say, actually, what is the best whitening process to fit into your life? We know there's a couple of teeth we're keeping an eye on, and we need to tweak those maybe afterwards, but we've got to get your teeth, the colour done to start off with. So if you've got any crowns in your mouth, any big fillings in your front teeth, they will not whiten. So we will have to replace those afterwards. So you've got to understand what the actual whitening process is. So in your box, this is really key, really, really important. These little tips come off and they turn. You take one syringe up. I often say to patients, these syringes should last you 3 or 4 days easily. The amount of gel you actually need to whiten teeth. It's hardly any the slow pace that we do them. So this goes onto there, turns, nice and tight. And what you can see at the end there is you push slowly the little plunger up, you'll see the gel start to come out. And what we'll often say to patients is you need very little on each tooth. And I say to my patients, I need a little about that much.
Okay.
Now what often I find is the patient will come back and say, I finished the actual box in a week, I've run out. Because what they're doing is they then come in and they press the whole syringe into one, and you just look, it's so difficult because it's my job to communicate you need that much per tooth, not that much per tray, and it's a really big difference. So what we'll do is show you how to actually put those onto the actual tray, and you'll see how many trays you need to have. So this is the Pola Day. So this is 6%. Trays, have you got a tray here? Fantastic. So if you have a look now into these trays, I ignore this back tooth.
Yep.
So what I will do is I'll put a little bit into each of those teeth. Do you want to have a go? I think you're probably an expert now. Perfect. Very little. Absolute expert, there you go. So you can see, if you have a look at the actual syringe, how little we've used. I've gone down by about that much.
Yep.
So these syringes will last 3 or 4 days. If you're using it twice a day,
Yep.
they will last a length of time, because you actually look into the tray, you can see we've used 1 to 2, probably 3 millimeters into each one, and then that's it really. Pop it in the mouth and then
Okay.
So if you want to pop it into the mouth,
I'm not sure me to do all of the
Yeah,
teeth.
you're
Is that alright?
Yeah. And it just fits nicely in there. And very little comes out, does it?
No, none.
With this trays, we've actually made sure that we're sealed right around the edges.
Yeah.
So we don't get any taste of it.
And you can still talk.
And you can still talk. And it's a really easy process for whitening. It's probably one of the easiest things I do. I quite like it when I see a whitening patient in my list. It means I won't really do very much. means that it's a really nice treatment for patients to have.
Yes.
Correctly. So this is something that I really quite like with my patients. It's like a top-up treatment. So all it is like a
Pen.
pen. And you can paint on the back of on the teeth. So you dry your teeth and you paint it on. Keep your teeth dry for 30 seconds and then that's it. So it's kind of a really handy, nice little way to top up the whitening when you're going off and doing something.
Okay.
So it's a really nice product as well.
And how often can you use that?
Use it daily. But it's just, like I said, top up for a period. It's not something I generally get my patients to whiten their teeth to where we want them to be. But if you suddenly think, I'm going out Saturday night, pop this, it almost becomes part of the regime.
Yeah.
You know? And it's something that I've used, my PT seems to like it. So this is another tray which we made earlier. This is actually for a different patient. The key thing with a whitening tray is always that sigh when a patient comes through the door and they've run out of whitening gel. They've used it all and there was no reason, and they're saying, you're not giving me enough whitening gel. All they've done realistically is press the plunger and just filled the whole tray with whitening gel, which is an absolute waste of time. So what I always say to my patients is all they realistically need to do is about a small blob in each area. So you can see, I'll do this with another syringe in a second, but just a small blob in each of the areas, about 2 mils. And that will be enough for the 45 minutes to an hour of whatever you're doing. Something that I always discuss with my patients is putting the actual little cap on, because when they're in the surgery, they often forget what you've actually said. So you make sure that they know you've got a little cap, you pop it on, and you turn round. Make sure you depress the plunger a little bit, and you'll see it come through. And show them exactly how much whitening gel they need to whiten their teeth. So a little blob in there, about 2 mils. And make sure that they can do it. It's amazing. Amy said she's practically whitened her teeth and she's got loads of gel left, which will last her for a top-up and makes you look really generous in your treatment, so then you can lead on to other treatments after that. Right as you can. So go in there, all we often do is just pop the heels in first, so we don't get the gagging. It makes such a difference, especially these days, especially with the whitening these days. I only generally do from 4 to 4 whitening rather than 6s and things, because A, when you smile you don't see them, but B, molars simply don't whiten. And there's also no need, because when you've got black, it's right at the back of the mouth. And also when you put the heels in, when you do it, wobble your toes, that makes such a difference. Well, not, but just distracts you, see. Yeah. So it's funny, when you're teaching students, it's actually what your impression's actually there for. So you're not often looking for the perfect impression. So you don't need that. So what you're actually trying to do is get from probably the premolars forward. Often I'll even cut off these, so all of it goes around. So you can see you've got a good seal around all the teeth. And it's all done. Super. So if you bring your mirror up for me, we'll have a look at the bottom teeth. Now we'll have a look at the canine. And we're not that dark, but compared to your peers in the pageant world, your teeth will feel dark.
Yes.
So is a normal St. Helens girl, your teeth aren't dark, but compare yourself to the bleached world. Yeah, you're very polite there. Right, put that back for me if you would. So open, so we have a look at these bottom teeth. So we're starting off on round about A3, just for your natural colour. Can you see that now? Yeah? And the canines, as we can see, are a touch darker. See that's nice A3.5, the darker colour. Can't remember what we said last time. So going back there. Now if we look at where we sort of kind of moved to. Have a look at these top ones. Look where we come from. They're getting there, aren't they? Yeah.
That's a big difference.
Massive difference. You look at where we've come to and where we are now. Look at the canines. Massive.
Oh wow.
Yeah? So there's that bottom ones there. You can see the difference, can't you? The nice stripe on those teeth, which is why I do the
top ones first because they're a thicker tooth, and if you do the bottom ones first at the same time, the teeth will whiten too quickly and you'll suddenly have this real stripe permanently. But now what we can do is bring those forward slowly, and the bottom ones will whiten within 1 or 2 weeks, really quickly. But they're often the ones that are really sensitive, so you want to not whiten those as long as for as much. Keep it back together for me. Yes, wonderful. That's easy, isn't it? Just take your jaw back, just normally, put your teeth together normally. Something, when I was lecturing at Manchester University, something sort of clicked a little bit of understanding why you're taking an impression and what the actual function of that impression is over the longevity of what you're actually doing. So when I'm whitening, realistically, I'm only really going to whiten from the 5, if not just the 4 forwards. I will avoid the 6s and 7s, so you don't per se need the impression of those. Obviously, as an impression goes, we'll get the 6 in, but if you cut missing a tooth off at the back there, does it really matter? Because you're not going to be whitening those teeth, so you're not going to be putting gels in those. But as you can see, it's a good impression of Amy from today, and we've got all the teeth that I actually want in there. So actually understanding why you take an impression is critical for any procedure, whether it's a crown, bridge, or a whitening trays in this case.